diabetes and have been prescribed insulin to take with a syringe and vial, there are a few things that you should know. There are many different kinds of insulin, and your doctor will decide what type, amount, and injection times are best for you. It's understandable if you're feeling a little nervous or anxious about taking injection sites, but with a little practice, you'll discover it only takes a few seconds to do and is rather easy. To help ease any anxiety you might have about taking insulin injections, we will demonstrate how to take an injection with a syringe and vial. Now let's begin. First, start by washing your hands with some soap and water. Prepare the insulin supplies and make sure you have the following items: the insulin vial, alcohol swab or cotton ball moistened with alcohol, and a new insulin syringe. Preparing the insulin vial. Always remember to check the vial to be sure it's the type of insulin you intend to inject. Also, check the expiration date. If you are using NPH or mixed insulin 70-30 or 50-50 insulin that looks cloudy or milky white, gently mix the insulin by rolling the bottle between your palms for 15 seconds. Fast-acting or long-acting insulin does not need to be mixed. Drawing the insulin into the syringe. Pull back the plunger on the syringe to draw in an amount of air that is equal to your insulin dose, matching the tip of the black plunger with the correct marking on the syringe, and remove the needle cover. Wipe the top of the vial with alcohol and allow it to dry. Hold the needle like a pencil and insert it through the rubber stopper on the top of the vial. Push the needle down to push the air into the vial. This will make it easier to withdraw the insulin. Leaving the needle in place, turn the bottle upside down. The needle tip should be fully submerged in the insulin. Pull the plunger down to fill the syringe to the desired amount of insulin. Again, using the tip of the black plunger to match the markings on the syringe. Pull the needle out of the vial. Gently tap on the side of the syringe to move any air bubbles up. Slowly push the plunger so the air exits the syringe. Now it's time to choose an injection site. Insulin can be injected into any of the following sites. The stomach. This is the preferred injection site. Stay at least 2 inches away from the belly button or any scars that you might have. You can inject insulin into the fatty tissue at the back of the arm, or the top and outer area of the thigh, or the upper and outer part of the buttocks. Remember, the insulin needle goes under the skin only, not into the muscle like the flu shot, for example. Insulin injections in general are easier than intramuscular injections. Avoid injecting cold insulin, since this can cause discomfort. When using the insulin pen or vial for the first time, take it out of the fridge at least 30 minutes before injecting so it has time to warm up. Rotate the injection sites to use a slightly different spot with each injection, and avoid injecting insulin into scar tissues or hard lumps that you may have. Insulin might not be absorbed as well if injected into these areas. Injecting into the same spot too often can cause hard lumps under the skin and can impair insulin absorption. You can rotate the injection sites in a pattern that works for you. Examples of rotation patterns are shown here. Once you have chosen your injection site, wipe it down with alcohol to make sure that it's clean. Now you are ready to inject the insulin. Gently pinch the skin with your free hand and quickly insert the needle straight in. Release the pinch and push down on the plunger at a steady motion until the syringe is empty. Pull the needle straight out of the skin and place it in the sharps container. Now that you have taken your injection, you need to safely dispose of the pen needle or syringe. FDA-cleared sharps disposal containers are generally available through pharmacies, medical supply companies, healthcare providers, and online. If an FDA-cleared container is not available, some organizations and community guidelines recommend using a heavy-duty plastic household container as an alternative. The container should be leak-resistant, remain upright during use, and have a tight-fitting, puncture-resistant lid, such as a plastic laundry detergent container. All sharps disposal containers should be labeled to warn of any hazardous waste inside of them. Follow your community guidelines for proper disposal methods. You should always store unused insulin vials in the refrigerator at a temperature of about 40 degrees Fahrenheit or 4.4 degrees Celsius. Insulin vials can be used if refrigerated until the expiration date listed on them. It is likely that you bought more than one insulin vial at a time. You should store all extra insulin vials in the refrigerator, except for the one you're currently using. Remember, do not freeze insulin or keep the insulin near ice. Do not keep insulin in a hot place, warmer than 86 degrees Fahrenheit or 30 degrees Celsius, or in direct sunlight. Do not use the insulin after the expiration date printed on the pen. The insulin vial does not need to be refrigerated after the first use. You can keep the insulin vial that you're currently using at room temperature, below 86 degrees Fahrenheit or less than 30 degrees Celsius, for up to 6 weeks. The number of days or weeks will depend on what kind of insulin you use. Congratulations! You've just learned how to inject and store insulin. Injecting insulin can be a very simple process, and the more you do it, the easier it becomes. If you'd like to see how to take an injection using an insulin pen, please see our other video.